sometimes people die from the actual, virus and what it's doing to the lungs, but sometimes they die because their immune response is too strong. So that makes treating it not easy, because sometimes you have to treat and attack the virus, and sometimes you actually have to stop your immune system from harming you. Salam, mənim adım Murad Məmmədovdur. Mən Bakıda anadan olmuşam və 10 yaşımda ailəm Amerikaya köçmüşdü. Mən artıq 10 il immun sistemlə bağlı tədqiqat aparıram. Kaliforniyada yerləşən Stanford Universitetində bu mövzu ilə bağlı doktoranturanı bitirmişəm. İndi də mən San-Fransisko şəhərində Kaliforniya Universitetində immuno-onkologiya bağlı tədqiqat aparıram. Bugün biz koronavirus bağlı danışacağıq. Sadəcə mən bu mövzuda İngilis dilində təhsil aldım. Ona görə üzr istəyirəm ki, İngilis dilində danışacağım. So COVID-19 is caused by a virus called SARS-CoV-2 because it's related to the virus that caused the SARS epidemic in 2002 and 2003. Just like the SARS virus, this virus lived in an animal, probably the bat, and at some point jumped to humans in China. This virus infects the respiratory system and can cause a lot of damage to the lungs. And this virus can cause a syndrome called ARDS, which causes inflammation in the lungs and makes it very difficult for the patient to get enough oxygen into the blood. And because of this, COVID-19 can also be very difficult on the patient's heart. These are the main reasons that people die from this disease. And in a lot of infected people, there are very few or no symptoms, but it's impossible to predict who will have symptoms and will have a very difficult disease and who will not have any symptoms at all. Mostly the people who are at risk are older people and people who have other diseases, especially diseases affecting the heart and the lungs. And also smokers and diabetics are part of the risk group, among other people. So people often talk about the flu and COVID-19 in the same sort of context. And in a way, they are similar because both are caused by a virus that infects the respiratory system, your lungs. But COVID-19 is significantly more dangerous than the flu. The mortality rate among COVID patients is difficult to estimate right now, but we know that it's much higher than for flu patients. For example, the overall mortality rate in Italy right now is 13.7% of people who are infected die. And in the US, it's 5.9%. But the mortality rate among older people is much higher, which would explain why the mortality rate, for example, is higher in Italy because their population on average is older. Aside from older people, those with pre-existing conditions are also, like I said, are part of the risk population. So in comparison to all of this, the flu is not that dangerous because the mortality rate for flu is about 0.1%. So only 1 in every 1,000 patients on average dies of the flu. And there are also two other big differences between COVID and flu. So COVID is much easier to spread than the flu. On average, one flu patient will spread the flu to 1 or 2 other people. This number is also hard to measure for COVID because it's too early, but it looks like on average, one COVID patient spreads it to anywhere between 1 to 6 other people. So it's much easier to spread. And finally, the flu is something that most people in our community have had, so most of us have some sort of immunity to it. Whereas COVID is entirely new, so we don't have any pre-existing immunity. So there are several important things that we still don't know about the virus that scientists and doctors are still trying to figure out. We don't fully understand how the virus spreads. That's one of the most important things for trying to stop it. Is it mostly spread through the air by inhaling, coughs and droplets from other people who are infected? Or can a lot of people actually get it by touching something that an infected person touched and then, touching your mouth? So that's kind of unclear. That's why we're asking people to wear masks, but also to wash hands thoroughly. We don't know why some people get so sick and die or almost die, while other people have very few symptoms. It's probably connected to the immune response and other diseases they've had in the past and their genetics, but it's not clear at all. We don't know why kids, luckily, almost never get sick from this, although they can be carriers. That's why it's important that little kids, especially once they go to school and they interact with other kids and they're spreading germs and viruses, that they don't come back and start spending time with grandpa and grandma and spreading it to them. We don't understand how the immune system responds to the infection, although we're starting to understand a little bit about that. So for all these things, we know a little bit, or maybe more than a little bit, but there's still a lot to understand that will help us in stopping this infection. We don't know if the people, this is one of the most important things, is we don't know if people who had the virus before and survived are actually immune to a second infection. So there's all these efforts right now to come up with tests that will tell you if you have antibodies against the virus, but that doesn't really mean that these people can go back and just do normal things, because we don't know if they're actually protected, and if they are protected, if they can be carriers and bring the disease to other people. One study, for example, in monkeys showed that you cannot reinfect monkeys a second time. So that's very encouraging, but we cannot be sure of that 100% for people until probably many months from now, after epidemiologists have had enough time to go back and look at people who had it and see if they got it a second time. So those are the main things that we don't know. And we also don't know why the incubation period is so long. Sometimes it's 2 weeks, which is very unusual. So those are the things that we don't know. What we do know is that, like I said before, it spreads much easier than the flu, which is why it's spread through the world so quickly. We know, like I said before, that it damages your lungs, your heart, and that sometimes the people die from the actual, virus and what it's doing to the lungs, but sometimes they die because their immune response is too strong. So that makes treating it not easy, because sometimes you have to treat and attack the virus, and sometimes you actually have to stop your immune system from harming you. So some have noticed that COVID-19 is causing more damage than so-called developed countries, and that in developing countries, the damage maybe isn't so serious. That's what people are thinking in, popular media and things like that. And that's an interest, and so people don't understand, like, why is that happening? And that's an interesting question, but it's really too early to know what exactly is happening. But so anything I'm going to say about this is just me kind of guessing and coming up with theories that are not proven yet. But if I had to come up with a theory, there are several possibilities. First, there's probably more travel to and from developed countries. If there are more infected people coming into some place, into some country or to some city, it's going to be much harder to control the epidemic in the beginning, because it's almost like a fire. And if you're starting a very small fire that is starting just from a spark, it's going to grow very slowly. But if all of a sudden you're starting with 4 or 5 different fires, little fires, it's going to take off and become one big fire much quicker. So because there are more travel probably connected with developed countries, they're more at risk of having people coming in that are infected and starting these local epidemics. So if that's the case, then it might just take longer for the pandemic to take hold in a country that experiences less travel. So I don't know if that's the case with Russia, but right now we're seeing an increase in infections in Russia in the last week or so. And that's just showing that each country, or at least each region of the world, has a separate trajectory of infections. And it's not really right to compare one country at some day to another country at some day. What's more informative and useful is to kind of see how their numbers grow over time and start at the very first case. And some countries like Korea or Singapore have done a good job, if you look at their trajectory, of making sure that it doesn't get out of control. Whereas other countries like the US have done a bad job, unfortunately. It's also possible that in the developing countries, that there are some developing countries that are experiencing a lot more COVID problems than we even realize because they don't have enough testing, perhaps. Testing requires a lot of infrastructure and resources, and it's very possible that somewhere in the world right now, somewhere that we consider a developing country, there's a lot of COVID patients that we don't even know about because they aren't being tested. And finally, it's certainly possible that people in some countries might be less sensitive to this disease because of genetics, because of their immune response, because of other diseases they've had in the past that maybe are in that region but not in other places of the world. That's very possible, but right now we just don't have any evidence showing that. But again, it's too early to tell. A lot of people are now wondering how necessary is the quarantine, the shutdowns. Is this too much? Are we overreacting? So I guess what I want to say is that right now, under the current situation, at least in the US, for example, or in other places where there's a lot of infections, the quarantine is absolutely necessary. Because once there are enough people in the community that are infected and dying from COVID, the only solution is to have a quarantine and to have strict public health rules and policies in place, such as mandatory face masks. After the rate of new infections drops to a low number, then you can start lifting the quarantine slowly. But you can only do that if you have other rules and policies in place that will prevent another second, third, fourth wave of infections. So like I said before, we live in a very interconnected world full of travel and trade. So while there are COVID infections around the world somewhere, nowhere is really safe from new infections unless you live on some private island and you don't let anyone in. We see that right now in China, for example. The number of local infections is under control. They got it under control. But then in March, they started having a lot of new infections coming from people that were traveling from abroad. And because of this, once we lift the quarantine, you have to have two things in place to make it possible for us to live without a quarantine until there's a vaccine or a treatment. So you have to have large-scale testing for the infection and something else called contact tracing. So, of course, large-scale testing will allow us to quickly identify people who are getting infections. And then we can ask them to stay at home for 2 weeks, and hopefully they can get healthy. But the other important thing is that we use contact tracing, which means that we go out and we figure out all of the people that they had contact with, probably significant amount of contact with, long conversations, or they live with them, or they work with them, or they interact with them at the store. And then we ask those people to also quarantine for 2 weeks, even if they don't feel sick. And once we have all of these processes in place, then we can lift the quarantine. But without that, it's just a matter of time before there's going to be another large wave of infections, and we have to have another quarantine, and then it's just a cycle that keeps repeating itself. Some people are saying that what's happening now isn't worth it because it's hurting the economy, and I guess that's up to the government to decide, how much they value life, mostly life of older people in our society, because those are the people who are mostly dying versus the economy. But if you ask people like me who are, researchers or biologists or people actually in the healthcare, doctors and nurses. Obviously, we prioritize health over the economy. Although I think if you ask a lot of economists, if the society is experiencing a large health epidemic, that's also not great for the economy. So it's not as simple as health or economy. It's very interconnected. So as we're starting to get closer to hopefully lifting the quarantines and the shutdowns, people are starting to talk more about what this second wave of infections is. What does it even mean? And is that going to happen? And how likely is it? So as we already mentioned, the modern world is highly interconnected, full of travel and trade, and different countries are experiencing different epidemic trajectories, like we said before. For example, right now, Spain, Italy, and France are seeing large decreases in new cases, and they're starting to get close to lifting the quarantine. In Spain, they're allowing people now to go outside for various reasons. But at the same time, the numbers in Russia are just starting to increase, right? And because of travel, we're all connected. We're not just in our own little bubble. So if Italy just goes back to normal life, without any rules, any new restrictions, they will start to see new cases very soon from travelers from around the world that are experiencing different trajectories of this pandemic. And the whole cycle will just start again. It's very predictable. It's pretty much guaranteed that would happen. So that's why when the quarantine is lifted, it's important that we continue to wear masks in public, that we thoroughly wash our hands, and that we stay home if we're feeling symptoms. And I just want to say one thing about masks. Wearing a mask protects other people from your virus more than it protects you from inhaling the virus. So if you choose not to wear a mask, it's not because you just made a decision for yourself that, I will take the risk. What's really happening is you're taking the risk for everyone else. And that's not really, that's the difficult part about this whole pandemic, is that people making decisions that they think just affect them really affect everyone, especially those closest to them, their relatives and other people they spend a lot of time with. So I think there's a lot that we can learn from history. Obviously, the Spanish flu pandemic of 1918 is a very good example that we keep looking at right now of what to do and what not to do. So in that year, for a lot of places, the second wave of infections killed more people than the initial wave of infections. And we can clearly see that, at least in the United States, for example, places like San Francisco that got rid of face mask rules too early saw a much larger second wave than places that kept the rules for a long time, like Philadelphia. And the second wave can come at different times for different places, depending on when the quarantine is lifted and how strict the local laws are. So it's very possible that until there's a vaccine or an effective treatment, we will have to go through rounds of quarantine to control the second, third, fourth wave of infections, unless we take this seriously as a society and have these rules in place that people are taking seriously, of face masks and what I mentioned before of contact tracing. We know now, for example, from data from New York City that approximately 20% of the city's population has antibodies against the virus, which means that they at some point were exposed to the virus. We don't really know why. So people are wondering, does this really change anything? What does this mean? So as we talked about this before, there's still a lot that we don't know about COVID-19. So all we can say from this information about your antibody response and whether you're positive or negative for COVID-19 antibodies is that it just tells you that you had the disease before, or you had the virus, even if you didn't have any symptoms. But we still don't know if having the immune response against this virus actually makes you protected against it in the future. So that's something that's obviously scientists are spending a lot of effort on right now and a lot of time on. If we find out that being exposed to this virus once and having these antibodies in your system makes you protected, then that's very good news for those 20%, obviously, because that means that probably they can go about their life normally without fear of having the disease again. And it would also be a good news for the general public, because the fewer people in the population who can get the infection, the harder it is for the virus to spread among us. So that gets to this concept of herd immunity, which explains that if enough people in society are immune against some pathogen, then other people in the community are also effectively protected against the pathogen, because there's just not enough people for the virus to jump from one person to another person. But herd immunity requires usually like 70, 80, 90% of the people to have immunity. So usually that's something that we get to with a vaccine. So, if enough people get the measles vaccine, then the few people who can't get the vaccine for some reason will also be protected. But we don't have those numbers for COVID, obviously. New York probably has one of the highest numbers of people who have antibodies against COVID, because there was such a large, epidemic inside of the city, and so many people were exposed to it. From numbers in the San Francisco area, for example, where I live, the numbers are very low, maybe maximum 2% or something like that. So that's not going to give us herd immunity. So practically speaking, it doesn't really change anything for what the government should do to control the infection. My intuition is that probably having it once protects you from having it a second time, just because of the biology of this virus and because it doesn't mutate a lot. But that's just an intuition, and that's something that we have to wait at least several months for enough people to get it, that we can go back and say, no, you can't get it a second time. So obviously we're all waiting for either a vaccine or a drug that will help us with ending this pandemic. So various countries and companies are currently testing both vaccines and drugs against COVID-19. So obviously vaccines are used to prevent a new infection. So that's the best case scenario, is if we can come up with a vaccine that we can give to the general public and stop people from getting new infections. And treatments are obviously necessary for people that are already sick or are going to get sick. So that's also really necessary. So a vaccine takes at least 12 to 18 months to be ready for clinical use. And I think a lot of people are wondering, why would it take so long? This is an emergency. Can't we make this happen faster? And it's really hard to make it go any faster. So firstly, making a vaccine that will be effective in making you have an immune response that's protective and is protective for a long time, not just for a few months, is not easy. And there's no standard recipe for it. There are different strategies for this, and you can never be 100% sure which of the strategies for making the vaccine will work until you just try them. So that's why there's a lot of companies right now that are trying a lot of different strategies that they have expertise in, and they're all trying as fast as possible to get these vaccines into trials so they can test them. So there's 3 general phases for testing both vaccines and drugs, and you really need to go through all 3. Otherwise, it's just not safe. So first, you have to make sure that the vaccine is safe, so you just give it to a very small number of people, mostly just to see that there's nothing in the vaccine that's going to make them sick. And then you can start in a again, a small group of people testing for how effective the vaccine is. And that's only possible if there's still an ongoing infection going on wherever these people live. So you give them an injection, and then you just wait and see, several months later, compared to people who didn't get the injection, if there are fewer people who get infected who got the injection. And then you have to wait and do another trial in a much larger number of people to see if, again, it's effective. You can probably combine the second and the third phase of that, but it still takes time and a lot of resources because you have to find people who live in places that are still having the transmission of the disease. Because if there's no transmission where they live, obviously they're not going to get infected. So in this emergency case of a pandemic, we can do the phases as quickly as possible, but to test the efficacy of the vaccine, you have to do it in a lot of different places in the world because you don't know where the virus is going to keep spreading several months from now. So again, all of that takes a lot of resources, and the only way to know if a vaccine is effective is to give it to a large group of people. You can't judge from 100 people because it's just not statistically enough people. And like I said, everything I just said about vaccines also applies to drugs. So testing drugs is faster, though, luckily, because you give it to people that are already sick, so you don't have to wait and see who gets sick. And in general, finding new and effective medicine just takes a long time because it's just complicated. Again, there's no recipe. This is just research. It's just chance what works, and it's extremely expensive. So not a lot of companies can actually do this. So the process requires biologists, chemists, doctors, a lot of other experts. And as everything in research, it's just unpredictable. And it requires a lot of testing. And there are a lot of quick studies that came out in the last couple of months saying this drug works or this drug doesn't work, but most of those are done in very small numbers of people. And a lot of times they don't have the right controls. The studies aren't well designed, and it's very hard to judge whether what they say is true. So right now there's a number of vaccine candidates being tested in people, and it's growing every day, the number of candidates. So hopefully at least one of these vaccines will be approved by next year. And there's also a number of drugs that are currently being tested. So one of the main ones is remdesivir, which there's encouraging information, encouraging data about its effectiveness. There's also the malaria drug, hydroxychloroquine. And then finally, doctors are also testing drugs that kind of stop parts of the immune system because, like I said before, the immune system can be part of the problem. And also people are trying this very old technique of using blood plasma from patients who already had the disease before and transferring it into current patients because the plasma contains antibodies that will hopefully help the patients fight the virus. So people are trying a lot of different things right now, and hopefully at least one of these will be very effective, or maybe a combination of these things will be effective enough that this isn't a fatal disease anymore. And I think that would really change the situation, because if it's not fatal anymore, then we don't need to be as afraid, and it really changes how we can carry on in our society. But it's just going to take some time, and until these things are figured out for the rest of us, we just have to be careful not to spread it in our communities. A lot of what we talked about, in a vacuum can sound scary, because obviously it's really changed how we live our lives right now. And these numbers can sometimes be hard to understand what they really mean for us. But at the end of the day, the scientific community, I think, is very optimistic that it's a solvable problem that just is going to take patience and time. And the community as a whole is putting all the effort it can into solving it. And like I said, there's all these vaccine trials, drug trials. researchers that are doing very basic research, like me, are trying to look at every possible angle. So inevitably, this will get solved. And the mortality rate, while it's higher than the flu, we compare everything to the flu, but it's not like it's SARS, which had a much higher mortality rate. And we know the people who are most at risk. So if, as a society and as a community, we're patient and we do the things that we have to do to protect the vulnerable people in the community, like the older people, then eventually it's going to be solved. It's going to take some patience, and obviously people are hurting for reasons that are not health related. Economically, it's very hard for people. It's hard here. It's hard in Azerbaijan, and it's sad to see how it's affecting people's lives. But it's a solvable temporary problem, and hopefully people can stay on their feet until it's solved. And overall, I guess I just want to leave it on an optimistic ending that it's going to get solved. It just takes time and patience.